In this course, you will need to perform joint assessments by measuring joint range of motion. This is traditionally done with a clinical tool called a goniometer. While it would be useful for you to purchase a goniometer to practice with, you can also roughly measure joint range of motion using the cell phone apps I have linked for you in the module. In this video, I will review what a goniometer is, the parts of the goniometer, and how to properly align the goniometer with bony landmarks. Then, I will show you how to substitute the goniometer with a cell phone app. This is a goniometer. It is used to measure joint angles. It has three parts: the stationary arm, the movement arm, and the fulcrum. This is the stationary arm of the goniometer. You can distinguish it from the movement arm because it is attached to a circle that has a bunch of measurements on it. The stationary arm does not move during the joint assessment, hence the name stationary. This is the movement arm. It looks like the stationary arm, but it does not have a circle and can move freely. The movement arm moves during joint assessment, hence the name movement. This is the fulcrum. The fulcrum is the axis of rotation of the goniometer. During joint assessment, the fulcrum should be aligned over the axis of rotation of the joint. Each joint has three landmarks to be used in joint assessment with a goniometer. The stationary arm is aligned with the midline of the fixed part of the joint, but sometimes it is aligned with a reference like the floor or perpendicular to the floor. The movement arm is aligned with the midline of the bone or the distal joint of the limb that moves. The fulcrum is aligned over the axis of rotation of the joint. For example, the hip has 3 points: the midline of the torso, the lateral femoral condyle, and the greater trochanter. First, you align the fulcrum over the greater trochanter. Then, you align the stationary arm over the midline of the torso. Finally, you align the movement arm with the lateral femoral condyle of the knee or the middle of the knee. For any joint, identify the 3 points and which parts of the goniometer they correspond to in order to measure the joint range of motion. It's important to first position the body correctly. For example, it is not possible to measure hip flexion if your client is prone or lying on their stomach. Your client needs to be supine or lying on their back to measure hip flexion. Now that we reviewed what a goniometer is, the parts of the goniometer, and how to position the goniometer, let's talk about how you substitute a goniometer with a cell phone app, which is pretty easy. Think of your cell phone as the movement arm of the goniometer. In this example, I will use my Android phone with the Angle Tool 2020 app. To begin, select 2D mode at the top. Next, identify the bony landmark for the fulcrum. Then, identify the landmark for the movement arm. Finally, align your cell phone between those two landmarks lengthwise. Zero the inclinometer app in the start position by hitting start. Instruct your patient to achieve their full range of motion and hit save. Record the number in the table in the lab. To review, it is important to first understand the parts of the goniometer and how they are aligned. Download one of the phone apps I suggested in Module 2. Before beginning your assignment, play around with it to make sure you're using it right. Finally, for each joint, identify the fulcrum and movement arm landmarks. Align your cell phone lengthwise between those 2 points and measure your client's range of motion. Post questions about substituting a goniometer with a cell phone app to the discussion or schedule an appointment to learn more.